We have with us today Dominick, and Dominick is 56 years old. I first saw him in July of this year, 5 months ago. He was referred by his brother, who had started the testosterone replacement shots and was very happy with it. And that's when we started the shots with Dominick. It was July of '08, so that was 5 months ago. So what was your, and now you had been on gel.
Yes.
For 2 years.
Yes.
Prior to starting the testosterone
Yes.
shots. So let's talk about how you were before you received any testosterone at all.
Before I received any testosterone at all, I was very tired and listless, and suffered from like anxiety, and sometimes like sort of like a panic, like very nervous, and not feeling that well, tired also.
Tired all the time?
Yes.
And would you say that this was chronic anxiety?
I would say it was chronic, yes.
What about your sexuality at that time?
My sexuality at the time wasn't too good. Maybe having sex like once a month or something like that. Or once every few months.
And once every few months?
Mm-hmm.
Well, how long had you been that way?
Oh, let's say a few years prior to that, maybe, let's say, maybe when I turned like 49, 50, something like that.
So that would be about 5 years?
Yes. Mm-hmm.
About 5 years. Okay, so you started on the gel, and what happened?
First, the gel seemed to work pretty well, but after a while, it had a lessened effect, and then what that other doctor did was to combine shots once a month with the gel, and that for a while was good, but then after a while he said, let's just stay with the gel and see how that goes, and staying with the gel then after a while wasn't too good.
So, but you didn't go quite all the way back to where you were before you started the gel?
No, it was still an improvement.
Yeah, but you had seen that the improvement was lessening?
Yes. Mm-hmm.
Okay, and at that time you were having sex a little bit more often?
Yes, a little bit more often.
Oh, you said a few times a month?
Yeah, a few times
okay.
a month.
And the nervousness had decreased?
It has decreased. Mm-hmm.
But did it go away?
No, it wasn't completely
Wasn't gone. And had the fatigue had improved?
It improved, but it wasn't completely gone.
Wasn't completely gone. At any point during this 2-year period on the gel?
No, it's not.
They did not disappear?
No.
Okay. So July of 2008, you come to see me, and we start you on testosterone shots. And what happened then?
Right away, let's say after maybe the second shot, I would say, then the anxiety dissipated, and I felt, more confident, and everything seemed much better.
The fatigue?
The fatigue went away.
And did the anxiety get better or go away?
It went away.
Went away completely?
Completely.
And sexually?
Sexually, was much better. And would go to have sex maybe a few times a week instead of monthly.
And you said also that you had increased self-confidence?
Yes. Mm-hmm.
So it made a big difference?
A very big difference.
So if you compare yourself now to the way you were before any testosterone, almost like a different person?
Almost, 100% better.
Yeah.
But similar to, like early 30s or 20s. Okay,
good. And has there been any side effects?
No, no side effects whatsoever.
So all good and no bad?
Yes.
The only thing that happened is that you lost 20 years or so of your life.
True.
And became younger, right?
Right.
Okay. Thank you very much.
Thank you.